Okay, so everybody, basically what I'm doing is what's called one Syringe Wonder. Vanessa is a lovely woman, young, who I brought onto the dark side about 7 years ago when I did Botox on her for the first time when she was about 25. Mm-hmm. And she would like to have a little enhancement of her lips. She has beautiful lips. So this, I want to show you what I do with people who have pretty lips. I typically will use, you can use Belotero, which is what I'm using today. I have pre-mixed it with 0.3 cc's of lidocaine for pain management and switched it together. In addition, I'm going to put some of that Belotero along with some Xeomin in an aqua gold device, and I'm going to stamp the product all over her face, and I'll show you that as I get to it. So what I'm going to do with her is I'm going to do just a little bit of, just take a deep breath and let it out slowly, and don't pant, just breathe normally. There you go. And the purpose of this is like icing on a cake. I'm not looking to make a major difference. What I'm looking for is to enhance what is already a pretty result. Naturally, she's very pretty without anything. So she indicated an interest in having her lips done a little bit. So it's okay to do a little bit of lip in people as long as they understand you're not going to do a lot. And remember what hyaluronic acid is. It's a wonderful lubricant, and it's very hydrophilic. So over time, it keeps the lips looking plumper and firmer than if you don't do this. When you're doing one syringe, it's very important that you match side for side and that you always keep in mind that you want to be even. You don't want to be finished.
Do you pull back on every stick?
I don't pull back on any.
Okay.
Yeah.
All right. Okay. And then what do you do if you hit like a vessel in there?
Well, I'll stop and I'll hold pressure.
Mm-hmm. Okay.
But really, I'm submucosal here.
Mm-hmm.
It is very, very unusual to get a problem with this. Breathe out, relax, relax. Try to always inject as people are exhaling rather than inhaling. So I'm actually switching now to a cannula. And the purpose of me switching to a cannula is I really want to show you a technique that I love for the nasolabial fold. Now, the problem is I don't know if I can find my stick spot. I made it too long ago, but let's see. Yep, there we go. Okay, so what I like to do in people who, I just want to soften the nasolabial fold, is I love to use a cannula and to go underneath there and kind of lift the nose a little bit. And the reason I like this, I don't know if you can see, you see how that almost immediately with almost no material lifts that nose area and softens that nasolabial? What I don't like to do is do a subcutaneous injection in the nasolabial fold. What I like to do is I like to just soften the peak and the sort of like, you can see how it's just not as severe on this side. That was almost no material.
Right.
So by using the cannula, number one, I feel I'm much safer.
Okay.
I can go deeper, closer to the bone, and I can give a little bit of a lift because as we age, the nose tends to tilt down, and this is a nice way to raise it up. So I'm going to thread it on this side. There we go. Here we go. So again, just keep breathing, Vanessa. You're doing great. It looks wonderful.
Yeah, it looks really good. You'll be happy.
All right. So I'm deep there. I'm deep. All right. So what that technique does is I absolutely hate the monkey look. This will never give you the monkey look. So I go in through the cannula, and I go in there, and I sort of lift it as a unit.
Explain what you mean by the monkey look.
The monkey look is when the skin is rolled and thickened, and you lose this definition between the cheek and the lip.
Because even babies have it at the end of the day.
You doing all right? All righty. So smile for me, my sweet. You see when she smiles, you see how she flattens here? So I want to give her a little bit more of a cheekbone. So you can do this with Voluma, but you can also do it with the lower viscosities. And what I do is I'm fanning it into this area in the sub-Q. And what I'm doing with this over time is I'm stimulating collagen production. And so when she smiles, this isn't going to scrunch as much. Again, I'm always moving back and forth because I want to make sure I keep her even. Remember, this is one syringe, so I don't want one side to look good and then go, oh, by the way, you need to come back. So you see what I'm doing here? And do me a favor, smile again. You see how she just flattens here?
Right.
I often don't like to chase crow's feet too much with the toxins because I think it affects people's smiles, whereas this makes the smile look better because you're enhancing the cheekbone in the subcutaneous plane and sort of like raising and stretching that skin. So that's another little sort of trick I use when I do the Syringe Wonder.